So 8 strategies for living well. Probably the number one thing I can tell you, and I want to say this really bluntly, you are not Nail Patella. You are not your Nail Patella syndrome. I hope you all know that. But what happens is we can get really lost in the pain, what we can and can't do, or what we used to be able to do that we can't do anymore. And we can start feeling really broken. And you are not your Nail Patella syndrome. And when I'm working with people with chronic illness and disability, the very, very first thing I want to do with them is start identifying what is right. What is right with you? That's what I would really like to talk about, right? As a psychologist. Now, we're here to talk about what's wrong, but I hope that's not your identity. I want you to know what is right with you. What are your strengths? What are you good at? That's what you should define yourself by, not by what you can't do. The second thing would be is to rethink what it means to be different. And I think this is kind of an art. And I heard some very inspiring stories from some of you who have worked around your Nail Patella syndrome to be cheerleading captain or running marathons or being in the Army. Or it's pretty cool what many of you have done, because you didn't let different mean can't. You didn't let different mean disabled. Now, there's things that I can't do, and there are things that I am disabled with, but I have redefined what that means. But I noticed when I was, actually when I was in my postdoc, that I was doing an awful lot of apologizing for things that I couldn't do. Behavioral health unit is usually in some kind of dungeon in sort of the medical center, you know. And so it's because I was working on the medical units instead of in behavioral health where my office was, I had to go way up to the emergency room, which was up this sort of, if you've seen The Exorcist, there's like this flight of stairs that looked like The Exorcist. And at the time, my knees were starting to dislocate. And I have to tell you, that staircase terrified me, right? Because, as you can imagine, that was a big deal. And now, I was about 30 at the time, or 29, and I was working with women who were in their 50s and 60s, and they would, you know, go up the stairs. And I found myself, like, for a few times, I just decided I was going to do the stairs, and then I was sorry that I did, because I had a 12-hour shift, and now I was going to be in pain, right? And so then I said, well, I'm not going to do that anymore. I'm just going to say I can't do it. And I found that I was saying, I'm sorry. I'm sorry, ladies, but I have to take the elevator. I'm sorry. I'm sorry. And I can't remember, I heard a talk about disability, and they said, don't apologize. And I had to really take that in, because I didn't even know I was doing it. I'm not sorry for what I need to do to take care of me. That's a good thing. If I have to not take those stairs because that's what I need, that's not something to be sorry for. So I stopped apologizing, but, you know, at first, you know, being who I am, a little quirky, they decided to, you know, go take the stairs, and I said, I'm not going to say I'm sorry anymore. I'm taking the elevator. And they're like, okay, Susan, whatever, you know. I explained to them later, but, you know, but it was amazing for me, just as declaring out loud, I'm not going to be sorry for what I need. Wow, that felt good, you know. I felt powerful. Yes?
How do you balance that with explaining to people when you have an invisible illness that you do have those needs and differences? Because I'm 31 and everybody keeps telling me I look
Fine. Yeah.
I can't tell you how many people that are in their 60s say, oh, you're too young to have joint problems. And I'm like, I'm going to hit you.
Yeah. You know what? So I went through that stage, and occasionally I feel that too. But you know what? I feel like I don't owe you, not you, but, you know, people, anyone. I don't owe you an explanation for what I need. So I don't even try to explain a lot of times. And they can have their opinion about me. They can think that I don't need it. But I have stopped trying. I mean, not with everyone. Some people I want to know. Yeah, friends and stuff. But, you know, for some stranger that says, oh, you're too young, I just, you know, whatever. That's your business. You know, what you think of me is not my business. So.
But I mean more like people that are involved in your life, extended family, friends that.
Well, friends that you know, and that's where you might take the time. But again, don't apologize for what you need. Just declare it. I have to be in this wheelchair, or I need these crutches, or I need to take the elevator, or I need to take those medications. And I don't, just be careful you're not apologizing for what you need. Was there another comment or?
When someone says to you, well, are you just lazy? Does it start to...
Well, I have never had anybody say that to me, but I've had a lot of stupid comments. I've had people say, you should stand up straight, and I said, I'd really love to, you're too young to have such bad posture, stuff like that. It does hurt, but I have to tell you, once you consciously get onto this, like you start practicing this, it starts to click, and it does require practice, but you kind of say, like, this is my new attitude now, and I'm going to try this out. It's amazing how good you feel when you stop apologizing. And when somebody says something stupid to you, you go, that's just evidence you're stupid. That's nothing to do with me, right?
You don't explain why.
No, I stopped doing that. I don't owe them anything. Now, if like she was saying, if it's a close family member, I might educate them. But some people can't be educated,
Yeah. I think even for family, it's tough.
Yeah.
With their comments. But
Yeah.
what I've done the past 10 years is saying, it's just my wonderful body.
That's my wonderful body.
And
I like that it's wonderful. Yeah. Yes.
So, Susan, I'm not sure if I agree with you because either it's a friend or someone you don't know. They may just make a comment like that out of sincerity, not out of stupidity, not out of wanting
Yeah.
to hurt
Right.
you,
Yeah.
just out of sincerity. But don't you think that under that circumstance, and we have to assume that it's being done with sincerity.
Right.
Under that circumstance, an easy explanation
That's what.
listen, that's the way.
And you have to decide on a case-by-case basis what is worth your time. But I have to tell you this, the person who said that to me and poked me actually in the back was nobody was worth my time, and I don't think she genuinely cared. Now, if it's a family member and you want to say she has Nail Patella Syndrome and that's why her arms don't go straight, I think that's a wonderful opportunity. But I don't think everybody has the best of intentions. Some people just like to comment. Just like Evan, would you gain, maybe you should gain some weight. Well, that's neither helpful nor something that is worthy of a response. But that's, and again, you're dealing with a kid. I'm talking about as an adult. So, when you're talking about you're protecting your kid, you may take the time to educate more. Again, what you do is going to be different based on where you are in the developmental process, but I don't mean as a blanket statement. You never explain or you never take the time to. But, again, you have to decide who do you want to take the time to educate and who do you want to just say, this is, just nod your head and whatever, It's not always stupidity, it's not, you're right. So when I say take responsibility, make choices, and take the power back, when I said take responsibility, I took responsibility for the fact that I recognized that I was becoming part of the problem, right? Oh, I'm sorry. I realize a lot of times how people react to my diagnosis have a lot to do with how I sell it. So I took responsibility for that, how I explain it, how I decide to portray myself. Do I say, oh, I'm a victim? No, I never say it like that, right? I say, there's things that are hard for me, and this is how I choose to respond. Make choices. Choose how you're going to respond. Again, you're not a victim. Don't act like one. It's amazing how when you don't act like a victim, you're going to totally change how people respond to you. Now, you can't control what happens to you when you're bullied and as a kid, but now as an adult, you can make choices of how you're going to respond. You no longer have to let those voices be how you determine how you respond. Some of you have had awful things happen to you related to your Nail Patella Syndrome. And life. Some of you were abused and had awful things happen. I tell this to my patients. And now you're an adult. You get to decide, are you going to become your own abuser and you carry on that message in your own head? Or are you going to change how you respond? You get to decide now. You're the adult. And find meaning in your differences. So for me, I have used my Nail Patella Syndrome, and some of the really hardest stuff that I've had to deal with has helped me in kind of weird ways. It's helped me become a better psychologist. And people respond really well to me, and I really think it's because of my Nail Patella Syndrome, because I've chosen to look for what can I learn from this. I'm constantly trying to learn, like, what do I hear there? What does that teach me? What did I learn about myself when I struggled with that? This is our other sister, Janelle. So this was a really good example in taking the power back. She was an extremely, extremely sensitive kid. My stepmom had me go into her, I think it was kindergarten or first grade class, to talk to her teacher because she noticed that Janelle would never take her sweater off, even when it was like 90 degrees in the classroom. And Janelle was just extremely sensitive about her arms. She was really self-conscious about the fact that she had no triceps and that her arms looked funny. And she was like that up until she was an adult. And she did, similar to Evan, she decided at one point, she says, why am I letting this define me so much? And she started wearing tank tops and sleeveless shirts and all this kind of thing. And this is her wedding dress. She picked a strapless gown. And I just thought this was a really good example of what you can choose. That didn't just happen. She had to choose that, And she had a little girl and she didn't get Nail Patella Syndrome, so I was pretty happy about that. And what was really interesting is Janelle said she was a little disappointed because she felt like they'd have more of a connection. And I think especially an important coping skill for when you have chronic pain and when things tend to be as sort of movable as they seem to be with Nail Patella Syndrome. I don't know about all of you, but I don't know what the next day looks like. It's different every day. And so I really have found taking it a day at a time is such a huge help. And that's another thing that really requires practice because our minds go off. They go off in the past, they go off in the future. And really to try and just be in the present, this moment, right now, is really hard. It's really hard. And the taking it a day at a time works in all kinds of recovery models, and I think including Nail Patella Syndrome. So it could help you cope with the pain of your body, with living with medical uncertainty, and even help you with things like depression, ADHD, or anything else that you're facing. One day at a time is a very powerful model. You take on today, and tomorrow then you take on tomorrow. There's a really wonderful quote that comes from the Dalai Lama. I just love it. It's pain is inevitable. We all have pain, right? Pain is inevitable. Suffering is optional. And I had to really toss that around because that word suffering, I feel like I see so much in my work. People suffer. And when I sort of separated that, I thought, pain happens to everyone. And sometimes we have emotional pain, we have physical pain, we have social pain. Pain happens to everyone. It's what are you going to do with that pain, right? How are you going to respond to it? Does it become your identity? Do you give in to it? Do you medicate with drugs and alcohol? Or do you face it? Do you take it a day at a time? Do you do what you can? That's where you keep pain in just the pain realm, and you keep it out of the realm of suffering. If this sounds appealing to you, mindfulness-based meditation really teaches a lot of this stuff. It's a non-medication approach to pain management that they teach in a lot of pain centers. It's extremely effective. There's a lot of really powerful research on it of how helpful it can be for managing chronic pain. So I want to say this especially to the people in the room who've had a child with Nail Patella Syndrome and you don't have it yourself. It's really important that you allow a language for sometimes this sucks, right? I can tell you, I've had it happen myself. Even I have Nail Patella Syndrome, and when Evan would come home and want to say how much it sucked sometimes because he got bullied or whatever, I wanted to fix it for him. Oh, you doesn't, whitewash it, Pollyannish it up. And you know what? I found I had to, say shut up, to myself. Listen, give him a space to say, at least for a moment, Mom, this sucks. Even one time he said, why did you give this to me? Right? But to sit with that, it's really hard. Now, I'm not saying you let them stay there, but let them say it. And it's important for all of you who have Nail Patella Syndrome, and probably for your partners and your siblings too, to say it sucks for you too. This is a family disease, whether you have it or not, and it can suck for you too. It's okay to acknowledge that. It's important that you do.
It's probably hard for a child of a
Yeah, to hear that. Yeah, and I think, again, if you listen, if we all here have a story, right? That's why you're here. Grief and loss is normal, is a very common feeling. When some of you have talked about not knowing you had Nail Patella Syndrome and then finding out as an adult, and how that feeling of grief and loss really could overcome you. That's normal. Again, you just don't want to stay stuck there. Sometimes a little worry can help you motivate. You just don't want to, don't want to stay stuck there. So a lot of even negative feelings have their role. They're important to feel and move through. Assertiveness skills are really important. That's saying what I need and what I want to do, and giving yourself a voice. It's saying I matter and you matter. Healthy way is to communicate and ask for help. So being able to ask for help is a very hard thing. I know I have a hard time with it. But also being able to say no. That's an assertiveness skill. Sometimes we have to say no. And being your own advocate. And I think that sometimes this is really hard. Being your own medical advocate. That's why sometimes it's helpful to have a family member go with you. And some of you have wonderful stories about parents or family members that were your advocate. And that's so important. And when you become the adult, you have to know how to do that for yourself, how to be your own advocate. And that requires assertiveness skills. Get support. We are a community. I think that, now with, I'm not on Facebook because of the nature of my work. It's a bad idea. But I know that all of you who are involved in social media and belong in the Nail Patella Worldwide organization on Facebook, and I don't know if you moderate that, Joanne, but it's a closed group, and I understand there's large numbers on there, and it's really, really a great way for you to connect with other people. And that's where it's wonderful that you have this, a conference like this that Joanne has been so generous in setting up for us. And I have to tell you, because I also run a small nonprofit organization, it's usually one or two people doing enormous amounts of work. And Joanne is so passionate about making sure that, especially for those of you, this is your first conference, that's because Joanne's been really willing to sort of, nobody wants to take on that job every year, and Joanne does it. Probably not because she wants to, but because nobody else will. So, Joanne, thank you. And really, some of the last stuff I want to tell you about is know when to get help, and be courageous enough when you need it to actually get it. Sometimes we know we need help, and then we don't go that next step. Whether you have depression or ADHD or body image issues or pain management problems, there's help out there. Depression is treatable. I'm just going to keep it real simple. Depression's treatable. If you have depression, please get help. Don't suffer with it. ADHD treatment, just a few there's good help for that too. One of the things I want to caution you about for kids, it's often with stimulants is how they treat it, which can really affect appetite and can have weight loss effects. That's why I decided to go the non-medical route with Evan, because he doesn't have a pound to lose. And so we did behavioral treatments for it. I'd be happy to talk to you offline about some of the things that work for that. The last thing that I really wanted to make sure I pointed out, I sort of edited this particular slide because of some of the things that you said. It's so important that you take time for your own self-care. That sometimes we get so lost in gathering things, or being working or raising your family or doing whatever it is that you do in your busy lives, that our own self-care becomes so bottom of the list. And when you're on the bottom of the list, it shows up in your health, it shows up in your emotional well-being. So whether it's that you do meditation or you do prayer or you take time for fun or you go to the gym. I just want to point out this is a real gym in San Diego. And so if you can't see it, what it is an escalator going up to the gym where people probably get in the gym and get on a stair stepper. Yeah.
People with bad knees.
Yeah. I just think it's funny because what you see is then people go in there and then they all stand in line to get on this stair stepper thing. So that's my contact information if you want it. SusanGuzman@live.com is my personal account, and that's actually my cell phone number. So remember, I'm on Pacific time, which means please don't call early in the morning. And that's me and Evan, and you know, he's my pride. That's my boy.